This is an example of good report.
Come in. Good morning, Miss Jackson.
Good morning.
This is Stacy. She's going to be taking over for me. She's going to be your nurse tonight.
Stacy.
Yeah, how are you feeling?
I feel pretty good today.
Well, that's good. I bet Erin took great care of you today.
She did.
Wonderful. We're going to continue that tonight.
Okay.
All right. So this is Miss Janet Jackson. She's 84 years old. She's a patient of Dr. Kulikowski, allergic to penicillin. She came in originally on the 1st. Her daughter went to go see her at home, which she normally lives by herself, takes care of herself, totally independent. But she was really confused, really weak, just wasn't herself, so her daughter brought her on in. She actually ended up in the ICU. They diagnosed her with sepsis, secondary to UTI, and some respiratory failure. Back there, they intubated her on the 1st. She was extubated on the 4th. She got a couple units of blood since admission. And they brought her out to us on the 6th, and she's been doing great ever since. So, history-wise, did you get her history already?
I didn't.
Okay, well, let me tell you, she's got diabetes, hypertension, she has coronary artery disease, some peripheral vascular disease, some chronic kidney disease, and a little touch of depression. Vitals-wise, when she first got here, she had been up to like 102.6 on that temperature. That has since broken. She's down, and she's been afebrile for the past 24 hours. Pulse rate 70s to 80s. Her pressures have been 120 over 80, really solid. Respirations have been 16 to 18 breaths per minute, and she's been 95% on room air. So, she, labs-wise, so she started off, of course, on admission. White count was all out of whack. She was up to like 20. Her lactic was like 5. All that has come down now. White count's only 11.2. Lactic is now within normal limits. Her H&H, I know you heard me mention that she got a couple units of blood. She was 6.8 on admission for hemoglobin, and now she's up to 11. So we're good there. She is Accu-Checks AC and HS. Last blood sugar was 130. She didn't require any of her sliding scale. Chest x-ray is improving. And admission, of course, it looks pretty bad with very significant infiltrates, but they are now improved. Bilateral infiltrate, she just had one yesterday. She is on fall precautions, and it's just, you know, just to make sure we still got our bearings, but she does really well moving around and everything. Assessment-wise, pupils equal round reactive to light. She is oriented ×4 now. She will have little moments of confusion in the evening, kind of sundowns just a little bit, but overall she does really good, very easily reoriented. She moves around well just with standby assistance, you know, and she knows to call, don't fall. That's our motto, right? She's in sinus rhythm on telemetry, rates been 70s to 80s, 2/1 pulses, and she's got some trace bilateral edema, but that's kind of a long-going thing. She's got Lasix that she's getting for that. Bowel sounds, her lungs are clear to diminished on room air. Occasionally you'll hear some intermittent fine crackles in her bases posteriorly, but they come and go. Room air now. She is using her IS like a champ. Good. She gets it up to like 1,000. I don't even have to come in and push her to do it. She just does it on her own. She's great. Bowel sounds are present. Last bowel movement was today, this morning. It was normal. Nothing abnormal about it. She still has a Foley. She has it for urinary retention.
Okay.
Which she mentioned that was an issue at home as well. So now we're trying to get that back on track. So they'll probably do a trial today to try to see how she does without it.
Okay.
But we shall see. It depends on what Dr. Kulikowski wants. Oh, excuse me, 1 second. I'm so sorry. My phone's ringing.
Okay, well today, what would you like your goal to be for your care? I see it was always being a 10.
Always a 10. You guys have been so wonderful.
Oh, thank you. Okay, let me update my information here real quick. Again, my name is Stacy.
No problem. Bye.
And I will have the same phone.
Okay.
Okay.
All right. I'm sorry about that.
That's okay.
So she has 2 IVs, both in the left arm. There's a 20 gauge that was placed on the 9th, and then the 22 gauge was placed on the 8th. And I'm sorry, I forgot to grab some gauze to get that out. I know today it expires, so if you wouldn't mind getting that out for me.
Absolutely, we'll get that out a little later.
Okay. She is on fluids, normal saline at 75. Medication-wise, she just gets some antibiotics. She gets Rocephin Q24 and some Zosyn Q6. And then she has her insulin sliding scale and everything. I mentioned the Lasix to you. She does have Norco for pain. She hasn't had any pain for me all day though.
No pain right now.
So,
Wonderful.
but it's there just in case we need it. She does have PT and OTC in her as well, just to kind of help her get a little bit stronger before we get out of here. They're expecting for her to discharge either tomorrow or the day after.
Okay.
The family is aware, and home health will be involved for when she gets home.
All right. Wonderful.
No skin issues at all. And yeah. Anything I may have forgotten or you want to mention to
I
Stacy?
think we got it all.
Okay.
That's okay.
Do you have any questions for
I
me?
don't. We're good.
Okay, good. Well, it was such a pleasure to take care of you all night. I wish you nothing but the best. I hope you get to get out of here
Thank
tomorrow.
you so much, sweetie.
Oh,
You've been
you're
wonderful.
welcome. You're so welcome.
I'll be back soon with your medicine. We'll get your vital signs. Can I bring you anything? Some fresh ice water?
I'm good.